Hi friends, I'm Dr. Madhu Nair, Orthopedic Surgeon, and today I'm here to talk to you about some tips for osteoarthrosis. As we all know, osteoarthrosis is a problem that afflicts most elderly, and generally it's considered to affect most people beyond 50 years of age. Now, osteoarthrosis is basically a degeneration of the joint. This we all know, and most of you all have seen elderly people being affected by it. You may have some people in your family, or you yourself may be affected. Now, during COVID times, it's a little bit more problematic because getting to doctors is difficult, getting your medicines are difficult, and getting exercises are difficult. And as we all know, for osteoarthrosis, exercises are a major contributor towards the treatment of the disease. I would not like to detail too much about osteoarthrosis, but everyone has to know that the knee is the most affected joint. In fact, most people come with knee pain. The hips, the shoulders, and other joints can also be affected by osteoarthrosis. Yes, some people do call it osteoarthritis, and that is how you may be knowing about it. But the general term now used is osteoarthrosis. As far as osteoarthrosis goes, the elderly today cannot go out and going to a gym, or because some may be using a gym, or going to physiotherapy because most physiotherapists may not be working, or the centers may be closed, or there may be restrictions in your area because of the prevention of spread of COVID. So what can you do to do some simple exercises at home that can alleviate your problems? Now, especially as winter's coming in, the monsoons are just been getting over and the winters are coming in, it's going to be a little more difficult to sort of control the problem. So there are simple things that one can do sitting at home. And in fact, don't sit. The idea is to be mobile. Keep your joints mobile. So how do we keep your joints mobile? And it's very simple. Every day morning, walk a little. Yeah, walking can be difficult for some, those who have severe osteoarthrosis. Sometimes even walking is difficult, but it can be done. Use a walking stick, use a walker, use some support. Try to walk. Even though walking can be painful, walking is a good exercise. Walk on a flat area. Never walk on irregular surfaces. So walking outside in the field or in your grounds may not be the ideal. But if you have a veranda, you can walk there. About half an hour, 45 minutes, if possible, is good. If you cannot walk for say you can walk for just 15 minutes and that's about your tolerable level, then you can walk for say 15 minutes about 4 or 5 times a day. The idea is don't just lie down, don't just sit, but keep your joints mobile. Now, even when you're sitting, you don't just sit. You try to keep your joints moving. So say if it's your knees, all you have to do is, if you're sitting in a chair, just extend or lift your foot off the ground and get your knees straight. Hold it for a count of up to 8 and then bring it down to touch the floor. Now this, if you repeat it about 10 to 15 times every hour, on the hour, you would be able to do about 150 to 200 reps per day. And that would keep your joint mobile. If it's your elbows or your shoulder, you can move those too. Your elbow, you just need to keep doing that. If you want, you can hold a bottle of water, about a half-liter bottle of water or a liter bottle of water in your hand, and just keep doing that, and that would be exercise. For your shoulders, you can just sort of do that every day, or this, and try to keep your joints mobile. You can do it standing or sitting. When you're sitting in a chair for a long time, or you're sitting on a sofa because you have nothing else to do, you're reading your newspaper, or you're watching TV, your back, your spine can get weakened and you can get back pains. Yes, just sitting can cause back pains. So it would be recommended that every half an hour or so you get up and walk for about 5 minutes. Now, even while sitting, all you have to do is sort of just stretch your back intermittently. Just do that, stretch your back, hold it, and then relax. You can even lift your hand up there and down. And this would help you relieve some back pain. If you have a cycle indoors, cycling is very good for osteoarthritis. It strengthens your thigh muscles and that helps to decrease pain. Most people may not have an exercise cycle, and in that case, you can take your simple cycle, put it on a back stand and cycle. But I think the elderly may not be able to do that. And therefore, just walking and these exercises will help you. Another exercise is also simple. That is, you just stand up, spread your feet to the level of your shoulders. Just spread it down to the level of your shoulders and sort of go into half crouches. Crouch down halfway and then go up. Doing these reps for about 10 to 15, about twice or thrice a day, will also help better your chest, your thigh muscles. So the idea is that during the COVID times, because our mobility is restricted by other factors, especially for the elderly beyond above 60 years of age, and because facilities are closed, though gyms are opening up, I don't think all gyms are open, and there is the danger of catching COVID. So it would be better to stay at home and do these simple light exercises. You don't need major weights. You don't need weights for all this. You can just do simple things. And the idea is keep mobile. And the more mobile you are, the more better you will feel. In later videos, we will try to bring in some, incorporate videos about the exercises to be done, the simple ways that these can be done, and maybe other data or other pictures that would be helping you to follow this system. I hope this short video has been of some help, and I hope that we will be able to help you further in the days to come. Thank you. Namaskar.